Good morning or good afternoon, and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator at Northwestern's Havey Institute, and I would like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing quite well. Beautiful summer day.
Absolutely. Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, July 10th, and we welcome any questions or comments down below or at any of our social media linked in the description. Starting today with a major outbreak of cyclosporiasis affecting many states, but especially here in the Midwest. Can you tell us about it, Dr. Murphy?
Yeah, this has really sort of come out of the blue. So cyclosporiasis is a parasitic disease. Up until very recently, it was a mandatory reportable disease. Now, it just so happens that recently FoodNet, that is the program that the CDC has, took cyclosporiasis, made it optional, that the states don't have to report it, but Michigan does. And Michigan has reported like over 1,000 cases with 50, which is, just an incredible number. They normally have 50 cases per year. This is like much, much, much higher. Actually, the most confirmed case, 1,251 as of yesterday, 44 hospitalizations. So it turns out it's all in the southeast corner of Michigan, and it has spilled over or also includes the northwest corner of Ohio, which has several hundred cases there as well. So they haven't been able to figure out exactly to pinpoint where this came from. There have been several other mini epidemics of this. In 1997, there was one related to raspberries imported from Guatemala. And in 2019, there was a case, there were over 2,400 cases linked to basil that was imported from Mexico. So we're not sure what this is, but this is like way bigger than any of those things. Typically, it's a self-limited disease that just goes away in a matter of days, weeks, or sometimes it could last for over a month. So we don't know where it comes from. It's an optional reporting disease now, which maybe that should be changed. But it's very unfortunate that this is going on now, and we don't know where this started. That's the big thing.
Mm-hmm. And because of that optional reporting, we have at least confirmed 1,400 cases, but like Dr. Murphy said, over 1,200 confirmed in Michigan, several hundred in Ohio, and about 140 here in Illinois. So that already adds up to over that number, and we will try to stay on top of any reports of more cases. But we do have some really good news in terms of influenza vaccination and how effective it actually is. Can you bring us those numbers?
Yeah, so flu shots offer pretty good protection. And a study from the CDC published this week in the Journal of Pediatrics, which is a very reputable journal, found that from August 2016 to July 2025, the seasonal influenza vaccine overall effectiveness against flu fatalities was 80%. In children, the rate was even higher, it was 87%. While it was lower, 77% in children with underlying medical conditions. And children younger than 5 years and those with certain underlying medical conditions are at increased risk for hospitalizations and even further complications. So influenza can be very serious. And it was just reported, I read actually this morning, that a trainee at Lackland Air Force Base in San Antonio, 25-year-old male, died from influenza. The thing with influenza, the flu, is that it is highly contagious. On Air Force bases and military facilities in general, as well as like nursing homes and other places where people are congregated, ships in particular, flu can spread very fast. And so they had 300 cases in the base reported in June. And this was incidentally 1 month after the Department of Defense made flu vaccines optional. You're no longer mandated. So now, because it's been such a calamity, that the mandates have actually been put back in place. Because imagine if we had to go to war or we had to mobilize people at one base or another base, and 300 people were out sick with influenza, it would be a catastrophe. If you look back at the 1918 big flu pandemic, it basically first started on military bases, and then moving the troops around in World War I actually helped really spread flu all over the world. There were more servicemen and women dying of influenza than actually of military action in World War I. So
Wow.
it's a while ago. They didn't even know what caused the flu back then, but it's a deadly disease, and from a public health standpoint, you have to mandate flu vaccines in highest risk populations, which includes those confined in places like military bases.
Yeah, it absolutely remains the best way to avoid getting sick is to get vaccinated. Now, we have more news on the Ebola outbreak from the Democratic Republic of Congo, something that with this strain, you actually cannot get vaccinated for. But can you bring us the most recent numbers?
Yeah, 1,759 cases. This is getting really big, with 600 deaths so far in the Ebola outbreak, predominantly in the Democratic Republic of the Congo, but a few cases also in Uganda and South Sudan. It is looking like that might be worse than the pandemic in West Africa that was back in like 2013, 14. So it's not under control yet. And there were striking Ebola workers, because despite all the money that's been committed, somehow hasn't trickled down to the people on the front line, which is just another problem associated with pandemics. If you don't pay the people who don't have the infrastructure, they can work for nothing. It's difficult to work in these places as well.
Absolutely. And you're risking your life to treat people and help ease people through their sickness and not getting paid. That is not a great system, unfortunately.
No.
Very sad. Now, something very interesting that we've been hearing a lot this summer is a lot of tick talk. TICKTALK, not the application.
Not
And
TikTok.
now we have some more information from the CDC that shows that this Lone Star tick alpha gal syndrome may be slightly more widespread than we thought. Can you tell us about it?
Yeah, alpha gal is results from a tick bite, Lone Star tick bite, which introduces the sugar molecule alpha gal into the human body, and that causes this immunologic reaction. And it can actually cause an allergic reaction that's fatal. Now, that's pretty rare. But the big thing is the big reason why everyone worries about it is that some of the people that get this alpha gal exposure can't eat red meat. So if they eat red meat, they get an allergic reaction. I just happened to meet somebody just incidentally a week ago over July 4th who couldn't eat like steak or hamburgers because they have this alpha gal syndrome. So anyhow, so they looked at 3,000 residual blood donor samples across 10 states. This is typically what the CDC does, or used to do even more. And nearly 1 in 4 adults in high burden states, like Arkansas, which is actually was 31%, far exceeds the 0.14% of US adults who actually have been diagnosed with the syndrome. So a lot more people get exposed than actually get sick. But there's an awful lot of that out there, and it's just another tick-borne disease you have to worry about.
Absolutely. And something else that is still rather rare, but is on the rise here in the US is West Nile virus, and it can be very serious. Can you tell us about the numbers?
Yeah, so this year, and West Nile virus is followed by multiple states. Illinois is a big reporting state for West Nile, by the way. They have very good reporting. The US experienced the earliest start to the West Nile viral season, which is late spring, early and summer. So 48 cases were reported in 12 states by June 30th. That's the highest case count at this point in the year since 2004, which is remarkably lower. So why is this happening so early? Probably because the climate is changing and the mosquitoes are coming out earlier and people are exposed earlier to this mosquito-borne disease. The bad thing about West Nile virus is that 79% of this year's cases so far have caused severe neuroinvasive illness, like encephalitis, and really a lot of them end up being hospitalized. So far, the bulk of the cases have been in Arizona, Texas, and Tennessee. But it can go to many, many, many more states, including Michigan and Indiana and Illinois.
Another reason to wear your bug spray, always stay safe. But we do have some good news coming from the WHO about the Hantavirus outbreak that we were previously experiencing.
WHO officially declared hantavirus over. The outbreak is over. After all identified contact testing has been negative and closing out this 3-month saga that produced 12 confirmed cases and 1 probable case and 3 deaths across passengers on this one boat that impacted actually 24 countries because people were getting off the boat before they figured out what had happened. A lot of exposure. A lot of people thought they had it because they got sick. It turned out they had something else. And actually, there were no person-to-person transmissions after people got off the boat. So that's all good news. But the hysteria that went along with the hantavirus was pretty remarkable and just very unfortunate how this thing all played out and all the hysteria about it. But this one is over.
Glad that one is over. And on that note, thank you so much, Dr. Murphy, for your time and your expertise, bringing us all that was important this week in public health.
Great. Thank you, Katie.
And thank you all for joining us this week. We hope to see you back next week. As always, any questions or comments are welcome down below and at any of our social media linked in the description. Have a lovely weekend.